Good morning. I'm Tonie, author of Living with Adult ADHD here at HealthyPlace. If it seems like I'm talking a little bit fast, it's just because both of my kids are here, so I'm trying to wrap this up before you hear a bunch of noise. So this week, the focus is on COVID-19 and how that's affected our mental health. For me, I have ADHD, and I can't honestly say that this pandemic has changed my ADHD much. I'm under medication therapy, and I also go to therapy, and I also have access to both of those professionals. So I've been really fortunate during this time. I do I do deeply empathize with those who are suffering from this. I understand that many people are struggling mentally, emotionally, and financially. So I do send my heart out to you if you fall into one of those categories. For me, I'm a healthcare worker. I do CAT scan at a hospital, and we sometimes work directly with COVID-19 patients. So I'll share with you a little bit about what that's like being on the front line. And I'll tell you that initially there was a lot of anxiety around that as things started to emerge and as we started seeing these patients. But right now, I realize that the best thing I can do is take care of myself and protect my patients and also protect my family. So knowing that I'm doing everything I can to keep myself safe has lessened the amount of fear surrounding the topic. And also something I've been practicing is social distancing online. So I've chosen to unplug from Facebook and Instagram. I'll check it from time to time, but for the most part, I don't check in. I don't need to know what's going on. I don't need to know any more stats. It's here, it's everywhere, and we know that, so I don't need constant reminders of it. And that has helped lessen some of the panic and fear surrounding the topic. My oldest is home all the time, so I'm homeschooling him, and that's actually going pretty well. We're using online homeschooling software, and he is really enjoying that. He's doing pretty well. I think I'm a pretty good homeschool teacher, but you'd have to probably ask him for the honest truth. I did also say that I was going to share with you how I'm keeping my symptoms in check, and how I'm keeping my symptoms in check. So for me, we do PE in the mornings, and what that really looks like is we go to the track, the kids run around in the field, they'll kick a soccer ball around, and while they're doing that, I'll run a mile, and that is a great way for me to start my day off. I personally enjoy working out, and I really love working out first thing in the morning. It really gives me that boost that I need in conjunction with my medication to kind of get my day going and get it going in a really good mood. And my kids, they burn off all that energy and they're pretty happy as well. So that's the main way I've been keeping my symptoms in check. And not only that, I've been trying to cook healthier meals and minimize processed food and minimize sugar because that is known to aggravate ADHD symptoms. So I got an Instapot, so we'll see how cooking goes because I'm not a big fan of cooking. But that's just kind of my little bit on it. That's kind of how me and my family have been coping with the COVID-19 virus. I am very interested to know how other people with ADHD are coping, just because I understand that my perspective may kind of be, it may not be common right now. So please do share with me how you are taking this all in and what you are doing to protect your mental health during this time. Thanks for watching.